Okay, next, our last talk in this session is going to be from Conley from the University of Alberta, Didactic Instruction's Impact upon Medical Legal Quality of RADOC Resident Physician Documentation. Conley.
Awesome. And I'm able to advance things on here. Oh, wow. Remote control. You guys are on it. Awesome. Okay. Thanks, everyone. My apologies in advance. I have a little bit of a cold. So if I'm coughing halfway through, sorry about that. But yeah, so my presentation, Didactic Instruction's Impact on Quality of Radiation Oncology Resident Documentation. So to start with, as we all know, clinical record keeping is a fundamental part of a physician's day-to-day practice, and good documentation allows for effective communication between members of the healthcare team. Radiation oncology has long emphasized this, in part due to the referral-based and multidisciplinary and often multi-institution aspect of the field. The American College of Radiology, in collaboration with the American Radium Society, has published practice parameters for documentation, but it is unclear if providers incorporate these in their daily practice. Studies analyzing physician documentation in radiation oncology have found room for improvement in documentation practices. As such, with this study, our aim was to evaluate the documentation quality of radiation oncology residents and assess the impact of an educational intervention in residents' knowledge and practice. So we started off by developing rubrics based on the ACR, ARS, CPSA, and CMPA published guidelines on effective documentation. These were reviewed by radiation oncologists at the Cross Cancer Institute in Edmonton, where we're based out of, and you can see one of the rubrics there on the right. Participants were asked to submit 3 random progress notes and 3 new patient consult notes that they had written, and a pre-seminar survey and assessment was administered to assess participant knowledge and opinions prior to the session. Participants then attended a didactic seminar on medical legal documentation. After the seminar, the survey and assessments were re-administered, and participants were asked to submit progress notes and consultation notes they had written after the seminar, and then these were graded using the rubrics created. So we had a total of 14 radiation oncology residents from the University of Alberta and University of Calgary participate, and this included trainees across all levels. Out of these, none had previously received any formal education on radiation oncology specific documentation, and nor were any aware of any documentation specific resources that were out there. We found that post-seminar, there was a significant improvement in participants' confidence in their understanding of documentation and informed consent, and participants did unanimously agree that the seminar was relevant to their training. So, as seen in these graphs, there was also a significant increase in participants' knowledge on documentation post-seminar as assessed by several skill testing questions we incorporated into the surveys. Along with this, there was an improvement in the quality of consultation notes and progress notes as graded by our rubrics. So to summarize, the educational seminar enhanced participants' confidence, knowledge, and quality of documentation. Taking this into consideration along with participant opinions, it is pretty clear that residents would benefit from at least some formal education on medical legal aspects of documentation during their training. Some future steps for us in the study would include reassessing participant documentation quality somewhere along the lines of like a year after we completed the seminar, which is actually approaching almost a year now, to assess the long-term effect of the seminar. And before I end, I just want to give a huge thank you to all of the my co-collaborators on this project. Most importantly, soon to be Dr. Vaishvi Patel, our really wonderful medical student who really took a great role on this project. And I'm happy to answer any questions that you guys have.